be.
Okay. Sorry, I got recording going. So for the recording, I'm on number 11. Sorry, I'll go back and try to say stuff at the end. Treatment, fenbendazole is the most common, which is the Panicure. You've got a fenbendazole praziquantel mixture, Advantage multi-sentinel Drontal. Pyrantel does not work though, which is your Strongid. But fenbendazole is the Panicure granules that we usually send home in packets that they can add to the food. Taniid type egg, what does it look like? The radial striations of the embryophore, which is that. And again, radial striations, I said it kind of like looks like the spokes of a bike. So that's definitely, you know, in that shell. Contains an embryo and it has 3 pairs of hooks that can be seen. And which is the flea tapeworm? So Diplydium caninum. So the Taniid are the Tania tapes. But the more common is the Diplydium caninum, which can be dog or cat and is zoonotic. And so that's what is often seen after fleas. One thing also that I said back in the lecture before is that sometimes you will see a flea infestation. You won't see proglottids near the rectum, but you might, and you won't maybe see it on a fecal, but sometimes the doctor may decide to treat just prophylactically, knowing that there could have been, you know, just again, this type of tapeworm is often seen after flea infestation. So know the difference between the 2 common tapes. And the tapeworm treatment, praziquantel, aprazantel, or Esprantel, fenbendazole can work, but again, Drontal Plus is the most common one that we use for the tapeworms. What does a flea tapeworm look like? A packet or a basket. If you remember, Diplydium caninum, the egg packets are found in the proglottid. And the difference, when we looked at that picture, I said sometimes that Diplydium caninum and a hookworm egg, because you see like kind of the eggs on the inside, except this one, it's a very thin shell and it's packed with those eggs, versus the hookworms tend to be more centrally located, have some space, and then the thin shell. And then definitely in the hookworm does have that nice kind of oval shape. It's not like a perfect circle. So that's the difference. But again, a lot of times in these tapeworm infections, you may also get a negative fecal, but if you see the proglottids, sometimes again, they're stuck to the rectum or, you know, near the fur, you sometimes see like a little flat rice, then of course you would treat, even if you had a negative fecal. There's the evidence. Let me pull up the, let me see if I can pull this up now. Nope. And pull up the quiz. Let me see if it'll let me. Okay. So I'm just going to go through the quiz. And like I said, you got your feedback on the quiz. So I'm just going to go through this. Hopefully you can see this. The common parasite names. So Diplydium caninum is the flea tapeworm and Celostoma hookworm. Cystospora coccidia, Trichuris are the whipworms, and Toxicera canis is a roundworm. So just, you know, maybe putting that on repeat on little index cards. Tania eggs closely resemble the eggs of Echinococcus species. So they have that similar appearance. And the genus of a tapeworm that releases its eggs in packets is the diplydium. So again, that looks like one giant egg filled with a lot of eggs, but again, it's very packed, close to the shell, is a way to kind of tell the difference. In humans, Toxicara canis is the causative agent of visceral larva migrans. Now, maybe creeping eruption, you were kind of leading to that, but this is where they get under the skin, can cause like little tracks, itching, very, pruritic, very itchy. In appearance, hookworm ova resemble strongyle ova. Now, I didn't spend a lot of time talking about the strongyles, but you'll want to review when we talk about strongyles in large animal. And I'll make a note about that. One thing that reminded me about strongyles in large animal is I would think strongyle strangle, because if you have a large animal that has a large worm burden of strongyles, it can cause an obstruction type colic or an intestinal obstruction. And in my head, I was like, almost strongyles strangle or block up or strangle the intestine, and you worry about blood flow and colic. So that's kind of how I remembered like strongyles in large animal, roundworms in small animal, but that might help. Which is the infective form of Giardia? The cyst is the infective, form. So you've got the trophozoite, sporozoite, endospore. If you remember when we looked at the cysts, that's actually, they've sporulated, they've made their cysts, and they can come in contact and become infective. Now, sometimes remember on Giardia, on a fecal, you might be doing a float, you could look at it on a smear, but you can see it in the different stages with Giardia. And also, I'm not sure if it would be on the test, there is a Giardia ELISA test that might, be able to pick it up, that you could send to the lab. Cestodes are tapeworms. I used to go cest tape. I'm going to go get some cest tape. Cestodes, tapeworms. So you get your nematodes and your cestodes. That's your answer. Identify this parasite. So again, thin shell, cluster of eggs. This is diplydium. So if you were kind of going between Ancylostoma caninum, which is the hookworm, and Diplydium caninum, then that would be your answer. If you look at this one, you've got this very thick, and you've got those striations. And we talked about those striations, and then we've got these little guys here in the middle, Taenia striations. So that's very distinctive of the Taenia type egg. Identify this egg. So we've got this very, they're small, kind of look clear. So we have got Cystospora, or this is Coccidia. So the common name for Cystospora is Coccidia. And identify this egg, and this is the Toxicara species. So this is the common roundworm. It's got, so it doesn't have the thick shell, the larger egg here in the middle, a little bit of space, but roundworm, Toxicara. Identify this egg. So you've got the thin shell, oval shape, clusters here in the middle, but this is going to be your Ancylostoma, which is the hookworm. So again, this looks kind of, if I zoom back up, let me go backwards, you can kind of tell the difference. This is very clustered, very tightly packed. And then here, it's similar, but there's definitely a lot more room. Not as many eggs here, kind of like packed in the middle. Ancylostoma. Trichuris ova mostly resemble the ova of Capillaria. So interesting, I didn't talk about Capillaria plica, which can be found on a urine sample, which affects the kidney. When I saw this in practice, It looks like that very distinct football shape, like a whipworm egg. That's got the two poles, except when you find it in urine, that's a capillaria. So capillaria and trichuris ova. Trichuris is a whipworm, and capillaria look like the football shape. That's the football. And oh, here we go. Identify this egg, and this is a trichuris, which, so you got the two poles, very oval shape, very distinct, very smooth, very distinct egg. Which of these parasites is known to cause thump or milk spots? And that is your Ascaris species. So this is the one we talked about in piglets. Ascaris suum is the one that would be, but again, Ascaris species. A gravid proglottid is what? A tapeworm segment filled with eggs. If it's gravid, then it has eggs present. So a gravid uterus is an egg gets fertilized, and then we know that fertilization took place and it's going to mature. So gravid is going to be the presence. So, and when we talk about a proglottid, that comes from a tape, one of those little segments, it is positive for a tapeworm segment filled with eggs. Which parasite ova have bipolar plugs, which we just looked at, and that is your trichuris. So it's got those plugs on the end. And which one has radial striations? And that should be the tania, which is the one we just looked at, and it looks like maybe like the spindles of a tire, or trying to think of the best way to put that. A dog becomes infested with Diploidium caninum by ingestion of, and this would be infected fleas. Now, you may have been, you know, a lot of these sound like, but because Diploidium is the flea tapeworm, infected fleas. So again, animals get the fleas, and then a lot of animals lick themselves, chew, they get this, and that's how it's passed. Okay. Okay. So let me go to, are there any questions about that? Okay, let me go back to the page and pull up the, sorry. So yeah, so let me bring up this sheet because, and I'm sorry that some of this stuff got put under your analysis in hematology. The nice thing, I'll probably be sharing with you guys, so I think I told you this before, like at the beginning of class, and if you're on Twitter, Vet Tech Prep has a Twitter page. Now, first of all, sometimes they'll tweet out just good review articles. Sometimes they'll tweet out these like little information sheets. They're kind of like these Vet Tech Prep page, and I've printed several of these that I have found, because they're kind of good little summaries for review. So this, you know, goes through the, you know, fecal flotation for the nematodes, and then this section. So it's got roundworms, talks about the treatment, talks about transmission, hookworms, whipworms. Then it goes down to the cestodes, which are your tapeworms. And then, like I said, I did not get into trematodes, which are the flukes. But I did talk about the Giardia, so there's some good information. Here's the Giardia elisa is the most sensitive. A lot of Giardia infections can get missed. And so it talks about the best way to diagnose this, which a fecal float, Giardia elisa test, and then a direct smear. So there's a variety, if you suspect Giardia, a variety of ways for it to be diagnosed. Here's some information about Isospora or Coccidia. And so this is a good little summary sheet that's on your Moodle page. And then, sorry, that was under here, but I can try to move it down. Where's the other thing I wanted to pull up about the drugs? Antiparasitics. Oh, let me do this real quick or it's going to be weird. Okay. Slide it over. Zoom it in. Okay, so again, here are the common drug categories. So, you know, I feel like on an exam, you know, you can talk about the common names. What do the common parasites look like? How can we diagnose them? How do we think the animal got infected? So hopefully we're picking this up, and then how do we treat? And like I said, you're going to have your very common drugs you're going to use every time it's a roundworm. We give this. Every time it's coccidia, we give this. And then any preventative the animal is on sometimes has, you know, a lot of the heartworm preventatives or sometimes flea preventatives. Add antiparasitics to it. So you're kind of like, again, my dog's Heart Guard prevents roundworms and hookworms. So, but I'm primarily, you know, preventing heartworm. Here's an added benefit. So fenbendazole, which is the Panacure granules, can treat all of this, although I will tell you it's most commonly used for whipworms. It's probably its most common use. And then your parental Pamoate, which is your Strongid or your rounds and hooks. And Strongid, if you guys have used it or if you've been in practice, it looks kind of like yellow. It's like a yellow kind of pasty liquid. It kind of smells good. It's supposed to smell like bananas and and then the Panacure tends to come as packets of granules that you can just, you know, a lot of times we just send it home with the owner and said, put it in some food, and most dogs will just, you know, you're not going to like sprinkle the granules, usually just mix it with something and they eat it. Ivermectin, again, it can be used. So if they're going to ingest it in a product, rounds, hooks, whips, heartworms, and bots. But ivermectin is a category that can also be used topically, and all, you know, Sarcoptes, Demodex, Otodectes, and Coxiella. Those are all skin type, ear type, you know, or things that we see. So again, ivermectin can be additive or it can be used topically. Metronidazole, which really is the main treatment for Giardia, which is known as Flagyl, but metronidazole is used also in just sometimes some general diarrheas. And sometimes I mentioned if you suspect Giardia, but you got a negative fecal and maybe we just missed it, sometimes they'll just treat for it. And maybe recheck a fecal. And then sulfamethoxine or Albon, which treats their cystospora or your coccidia. Albon smells really good. I don't know, I always like the smell of Albon when I fill it. Now when we get into the praziquantel, we're talking about Echinococcus taenia or your tapeworms or your flea tapeworm. Isprantel can also take care of both, but this would be your Droncit. So Droncit tablets are often usually what we send home for positive tapeworm sample. And again, I'm just sticking on intestinal parasites for this test. So there is some information about heartworms, but that won't be on this test or the flea medication. So don't worry about that. Our next section is vaccines or wellness. I'm just going to add a little bit in there about heartworm and flea because it's kind of like part of your preventative vaccine program. So I'll probably add that into that section. So those are the resources on your Moodle page, which again, there's a few things up here. And then under parasites, there was also, let me just talk about this, review this real quick. The fecal exams that can be done, excuse me. Let me scooch this over. Okay, Bobo. Okay. So just don't forget to, when we talk about simple float, the sodium nitrate, which is your Ficosol, is the most common, where you put some of the feces in with the solution. The float causes the eggs, and you put the little slide on top, and then the eggs adhere to the slide. Now you can also do a float via a centrifuge, where you would put it in a tube, and you put, believe it or not, the spinning, the cover slip will stay, but then this would be, a little bit better, maybe in like another technique that you could do. It does say gold standard. You might yield better results, although I would say most practices, you're pretty much going to use your standard float, which is your little fecal tube. You buy those kits, and then you buy the Ficosol, and that's kind of what's done the most in practice. You can do a sedimentation if we're talking, if you're looking at heavy eggs that maybe won't float as well, or can be distorted in the solution. So, if you centrifuge, you know the difference between a centrifuging float versus a sedimentation. Now, whenever you do a sediment, your things settle to the bottom, you pour off the liquid just like you would do a urine sediment, except you're using fecal solution and and fecal, not a urine. There's different solutions. Sodium nitrate, which we talked about, is your Ficosol. Talked about the specific gravity, and the only problem is it can crystallize. You can make the sugar solution, but it won't distort. It's just a little bit messier, so you don't get the crystallization. But as long as if you can check the fecal within that 20-minute, don't set up your fecals if you're not going to have time to do it. So no, you can always keep them in the fridge, and maybe do your fecals all at once so that they don't sit. Zinc sulfate, which can be good for Giardia, and there's an Ovasay Plus, so there is a kit that uses zinc sulfate as the primary ingredient instead of that sodium nitrate. Magnesium sulfate can be made from Epsom salts, but it tends to crystallize a lot faster. And then there's sodium chloride. Now, and again, the most you're going to use is your standard float. Your other option is to do the direct smear, where you put a drop of saline, you can take, if you have a toothpick, or you can use the opposite end of like an ear swab, take a little feces, mix it. The thing when you do a direct smear is you want to try to spread it out evenly and not get a lot of chunks. You want to be able to see through it. And again, you can put a cover slip on and do a direct. Now, again, you're not concentrating or floating a sample and letting it sit. You don't want to make it too thick. The other thing you can do when I think about smears is, a lot of times we do this if we're looking for bacteria, where we'll spread it. I will smear it like an ear smear, flame it, and then you stain it, and you might look for bacteria. So direct smear can be this method, or smearing it and look, but bacteria, I'm not talking about parasites. So that's the difference in the two techniques. And then there was a little note about the specific gravity of the fluid, which 1.25 is what is preferred. Okay, does anybody, so I talked about the fecals. So as far as doing a test tomorrow, and I'll email you for timing, usually it'll open up around probably 11 till like 5 or 6 p.m. to give you some flexibility if you're in surgery, or you're doing blood work later. So I will email you the timing. It'll be on Moodle. And so things to cover is we talked about the fecals and the medications. Those were the two handouts. I'm going to post the parasite questions we just went over with those answers if you want to quiz yourself, and then you also had your practice quiz. So does anybody have any questions on any of that? Okay. So, so I will email you later about the test. You have all the information. Don't stress. It'll be fine. And then we'll move on probably again, like I said, to wellness, which I know there's lots of sections on your page. So I will definitely know you which, or tell you which handouts that you need to know, you know. So I'll make sure that, since there's a lot of extra, I want you guys to have all this information, however it will help you. So I'll try to point out what you need to know. Any other questions?